Yeah, 11:05. We are right back at it. Dr. Payne Show. Lines are open. You have concerns about your health. 416-870-6400 star 640 on your cell. How you doing, pal?
Hey, big guy. Good. You?
I'm good. I'm looking forward to what we're talking about today. What do you got
Good.
for me?
So I have a couple things I want to talk about. The first thing that I want to talk about is just sort of sometimes I have to step back as a professional and forget that the people that are coming in to see me don't necessarily have the knowledge base that I have, which is the reality, which is why they're coming to see me. I had a person this week that came to see me, and it was a hand complaint. It was essentially like a bone bruise, right? And these things but the diagnosis is not what's important. It was a bone bruise, been going on for, I believe it was almost a year now. And they had really gone to their family doctor in order to manage this. And the family doctor's recommendation was, it'll just heal on its own. Like, don't do much about it. And then, of course, here we are a year later.
Yep.
Not getting any better. And I mean, when I hear this, for me, it seems simple. Like I always say, a mechanical problem or a manual problem requires a mechanical manual intervention, right?
Sure.
So therapy is likely the answer, the first thing that you should try. And it seems so inherently clear to me. And I said to the person, I said, but have you done any therapy? And he was like, no, I haven't done anything. And it's like, well, why not? My doctor didn't tell me. Yeah. And right in that moment, I realized, like, initially I was sort of like, well, why wouldn't you do that? But then I stopped and I thought, and people do put a lot of faith in their family doctor and listen to every single thing. And this is not supposed to be, this is my intention of this is not a segment against family doctors, because I know many, many family doctors that the first thing they would have recommended is therapy. But the point of this is that I also think that patients need to do their due diligence as well. We are not in the 1950s anymore where your doctor knows everything. Just listen to them. Like, do some research, speak to some other people. Therapy interventions like chiropractic, physiotherapy, massage therapy are often primary care, which means you can just go in. You can just go see somebody, get their opinion, and get it treated the right way. And again, for me, it was... I felt like when I heard it, it was odd, because I was like, well, why wouldn't you have gone to get therapy right away? But then I really took a moment and I said, well, take off your practitioner hat. Like, forget that you're a professional. You likely, if the roles were reversed, would have done the same thing. And you know what? I probably would have. If I wasn't a healthcare professional, I was just a person with a hurt hand that had gone to my family doctor and was told, yeah, just let it rest. Here's some meds. That's all I would have done. And not until it got to that point where a year later, where it's like, no, this is still bugging me. What can I do? Let me seek out another opinion, which is when he came to see me.
Right.
So number one, and again, although this is not an intention to try to bash family physicians or anything like that, because there's incredible family physicians. They all play a very important role in our healthcare. They're the gatekeepers. But I also would encourage most family doctors, you should be aware of this, that if your patients have physical issues, then likely physical intervention should be the first line of defense. And this isn't me saying it. This is research supported recommendations. Like, if you have someone to just tell somebody, just rest, is no longer the approach.
Yeah.
Almost in no instance whatsoever, outside of things like fractures. And even with fractures, there's still some therapy that can be done to maybe help expedite the healing process, et cetera, et cetera. So there's a limited few cases where you would say complete rest. But in general, someone like that, you have a mechanical injury to some part of your body, the initial recommendation should not be don't do anything about it. Maybe it can be don't do anything for the first 3 to 5 days, which, again, depending on the injury, maybe not. But definitely you should not let a patient who continues to come back and has this going on for a year, and in that whole year you've never recommended therapy. To me, it makes no sense on a professional level. And then, so that's the side for the physicians, but for the patients, do your due diligence.
Question it a bit sometimes.
Question it. Just do a little bit. Like, there's a fine line we always talk about, don't go to Dr. Google, but there's also a fine line of research without being, a hypochondriac about it, right? So and it's great that we live in a time where we have all these things at our disposal that the average person can figure things out. And it's all about moderation, right? Like, you can do that. I always encourage people, you should know what's going on to a moderate level, but don't think you're an expert that now you're the doctor, right? Just understand, question it, make sure you're getting the right therapy. And of course, if you want to see me for those second opinions on these things like this gentleman did, I'm happy to see that. But this person will likely go about 4 or 5 treatments and feel probably 95% better.
Right.
It's been going on for a year and a half, so is this something that will disappear forever? Hard to say, but it's not a bad injury, and definitely the physical intervention will help tremendously. And I think that's a very, very important thing that people understand, that physical problems likely require a physical intervention as a first line of defense. That doesn't mean other things are not part of it, but definitely it should be part of the picture.
416-870-6400, star 640 on cell. Good way to start. Bring on your questions and comments. We'd love to talk to you up until around 12 o'clock this afternoon, right here, Dr. Payne Show, Global News Radio. It is 11:15, Dr. Payne Show, 416-870-6400, star 640 on cell. Yeah, have a little inclination about your own health. You live in your body 24/7, so... you're funny off the top. You said, you trust your GP because they're the gatekeepers
Which you should.
Of healthcare.
Which you should, yeah.
And I remember having this conversation. In fact, I've had this conversation several times with my 77-year-old father-in-law about, the keto diet and protein and working out. He's like, how many eggs do you eat a day? I go, anywhere between 3 and 6. He goes, oh, my doctor said 1 egg a week. I go, is that the 1800s that advice came out, or 1 egg a week? Because dietary cholesterol causes heart attack. I mean, dude, you got it. Things improve.
Yeah.
We learn new
things
stuff.
Change in different people and all of those things. There's also fads, so we also don't know the extent of, and I know this is hard for you, but we don't know the extent of the future with the keto diet because it's relatively new. But you're absolutely right. It's all about, like, there's too much rigidity. That I believe is the problem. Like, even me, there's things that I've learned or that I've studied, and we've had this on the radio sometimes before where someone's called and said, what's an example? Have you ever heard of training on sand or whatever? I remember there was a call once. Yep. No, it's not something I've ever done, I've ever looked into, that I've ever recommended. Does that mean it doesn't work? No. Does it mean that it works for everybody? No, probably not. It's about rigidity, and I think there needs to be more professionals that aren't as rigid in their approach. And I think that's the way I try to be. I'm very much like, hey, I don't know everything out there. Here is what I know. Here's my recommendation. If there's something that I'm missing or something you're interested in, I'm happy to do the research to figure it out, to start to put different pieces together. But you're absolutely right. Some professionals are just so rigid in their recommendation where it's like, no, absolutely not, never. And it's like, well, no, there's moderation. There's also, everyone's different. That's the thing. It's all about people are different, and psychology plays into everything. And there's so many variables. But you're absolutely right with some professionals, just the rigidity of their recommendations. And the other thing is making sure you're absolutely right in one facet there, which is the progressive knowledge that keeps happening. Right? Healthcare does not stop evolving. It's not like whatever we knew 20 years ago is the same that we know today. There's been new evolution. There's new things. I mean, in terms of the eggs, 100%. I remember, it's funny. When I used to work summers in construction, there was this old guy who had a farm that used to work with us, and he would have like 5 or 6 eggs a day. And he was like 70 years old at that time. And I remember early on in my university when I started, we were still at that point where, like, dietary fats very much contribute to heart attacks, this, that. And I remember I used to tell him, like, you shouldn't be eating that many eggs. Like, that's a lot of eggs.
Settle down.
And he was like, hey, and an old Italian guy, and his thing was like, believe me, they're all wrong. This is the best thing for you, right?
Right.
And it's funny because then as I went through school and new research started coming out, it's like, yeah, they're really not that bad for you. Now, obviously, but if you're having just a boiled egg, something like that. Now, is there a fine, like, it's like bananas too, right? Like a couple bananas a day is good. If you eat 300 or 400, that's a lethal
sugar
injection, right? Like down. It's a lot of potassium. So there's always a moderation of everything, but the rigidity in recommendations from healthcare professionals is something that I personally disagree with, and I would hope that as we continue to evolve. And when we're speaking about this, I think it's also the vast minority of professionals that are that way.
Oh, for sure.
Because when I say healthcare professionals, I mean anyone, GPs, chiropractors, physios, surgeons, whomever. The majority that I interact with, the vast majority, and I've interacted with a lot on a professional level, friendship level, they're all very much plastic in the way that they think about things, and they're very open to a lot of different things. But you are right, there's a subsect of healthcare professionals that seem to be very rigid in their recommendations.
You want a nice combination of doctors who have just got years of clinical practice and knowledge, and the ones who still go back for training all the time and are open to new ideas. My GP is younger than me.
Yeah.
So when I started keto, he's like, okay, cool. Let me know how it goes.
Yeah.
I'd like to learn more about
Well,
it.
what you just said, though, is what we call the evidence-based medicine, right? Evidence-based medicine is what's the best research out there, scientific evidence, clinical experience of the professional, and what the patient wants. Right. So if you're going there, you want to do it. There is good evidence around it. And the clinical experience of the clinician is like, yeah, okay, I don't see a problem with it. Well, then that's evidence-based medicine. You can't ask for anything better than that. That's why there's 3 facets of it.
Yeah. I remember seeing old Christmas photos when my mom was in her teens, and it's, the whole shot of the long shot of the family table. Everybody, like the kids, everyone's smoking a butt.
Oh, yeah, exactly.
But then she goes, we didn't know. We didn't know.
Yeah, they didn't know. Yeah, I believe my mom smoked while she was pregnant with me, which might explain a lot. Might explain a lot of things. But again, at the time, it was just it wasn't really frowned upon, and maybe we didn't understand the extent of it.
416-870-6400 star 640 on sale. You got health questions, bring them on. Dan, I see you there. Hang on the line. We'll get to you after a short break. Dr. Payne Show, Global News Radio. It is 11:23 at Dr. Payne Show till noon. You want to reach out, 416-870-6400 star 640 on cell, and info@painecarecanada.com. By now is the email address for the time being at 11:23. We were just talking about the way things change. People used to smoke. They used to eat this. They used to drink that. But there's still those people out there that live to be 106 doing that stuff.
100%. Right? Well, it's fun. Another funny point. I was speaking with a colleague of mine, and it's pretty incredible when you hear of these people. Number one, genetics plays a huge role in anything. Let's just start there. These people that sort of make it there, I don't know for sure, but I would say that a lot of it, the vast majority.
What's your secret? Don't bother asking.
Is genetics. Yeah. You got the right combination of genes and chromosomes that did the right thing for you. But the other thing that I believe is that your disposition, your mental disposition matters a lot, because I know there's a family friend of mine. He was my dad's friend. My dad passed away 11 years ago, but he's 84 now, or 85. This guy drinks, eats, like everything that you think someone should not do at 84, he does it. But he's very active. He still does all kinds of, he still goes to work. He does work around the house. He's as strong as an ox. But he'll eat all kinds, and he'll eat all the things that you would say, well, you shouldn't eat that. Breads, pastas, like
soaking up the gravy on the plate with a loaf piece of bread.
Typical old Italian man. Drinks wine every day, scotch at the end of the night. I think he even starts his day with a little bit of sambuca in the espresso. So
love this guy.
Yeah. Oh, he's an amazing guy, just an absolute. But the one thing about him, every time I talk to him and you ask him, like, how you doing? It's always the perfect, awesome. Beautiful, happy as hell. And the other thing is, I know a lot of people that can eat like that, and people that are not in great shape, and they eat that stuff, but then they sit there and, I shouldn't have ate that. I'm going to die so young. Like, if that's your mental, if you're going to do it, which I don't condone doing it, I think a healthy, balanced diet is very, very important. But at the very least, if you're going to do it, I even know people who are smoking cigarettes, and every time that they're having one, they're like, this is going to kill me one day. This is going to kill me. Well, probably and definitely with that attitude, right? You know what I mean? Like,
for sure.
But there's a lot of people that you see in the news that end up living to 100 or whatever, and they smoke every day, they drink, and all of these things. But I think a lot of it is, number one, genetics and their disposition. If you have a belief that something that you're doing is bad for you, well, then it probably is bad for you, but also psychologically you're amplifying it, right? Yeah. And so I think that's an important component as well. That now, I'm not saying, go smoke and just don't
be happy.
Be happy about it. But what I am trying to say is that your mental disposition towards these things matter, and I think that highlights your mental disposition overall. If you're a positive person versus a negative person, I think there's something to be said about that, and that ties in nicely to obviously what we do with pain management and injury management. There was actually a lovely, lovely lady that I saw this week. I've actually seen her a few times, and is having low back pain. 88 years old, so nothing major, very much mechanical, just needed a little bit of advice on, some exercises, some movement to do. A lot of it was just simple self-care, because it wasn't very bad, and it was more about her just keeping moving. And also, one thing that I find with the elderly that are incredibly healthy, right? Because when you think of an 88-year-old who just has a little bit of back pain, in general, most people would say that's awesome. The thing is, with these people, they seem to think that that's like, oh my God, like, and I tried to explain, well, your body is breaking down, and it was hard for her to accept that. It was like, well, no, like, I've been fine up until now. And it's like, yeah, I understand that. But the reality is, age does create wear and tear on the body.
Yep.
Doesn't matter who you are. That is the reality. That's why we age and we break down. But she's also been going through an incredibly hard time, having lost her husband, family, and all those things. And as I was speaking to her more, and I had seen her a few times, I didn't really know that much of that part of the story. And as she was going through it, I said to her, honestly, I think the majority of what you're feeling in your body is simply a reflection of how much anxiety, depression, things are going on inside. Like the amount of stress that you're conveying right now is just like it made it very much. I was very
Your
much.
back started to hurt,
Yeah, no, not hurt. I felt so bad for her emotionally. Yeah. Like I really wanted to help her. And I encouraged her. You need to find social support. You need to find all of these things that will help you from that side. Because if your mind feels better, then I think the little bit of pain that you're experiencing in your body will also feel better. And that is very, very true and consistent with pain.
My mom's the same way. 85, knees are completely shot, but man, is she positive. And she's still doing
and she
well,
probably does really well with it. Yeah.
And I once heard that, you can live to your potential. You may be genetically live to it. You won't live past 100 genetically, but you can live less with bad habits, right?
Yeah.
It's pretty cool to think about.
For sure.
416-870-6400, star 640 on your cell. Dr. Payne Show. You got a half hour still. Plenty of time. Call in. Would love to talk to you about your concerns right here on the Dr. Payne Show on Global News Radio. It is 11:32. Dr. Payne Show. 416-870-6400, star 640 on cell. Don't wait till the last 5 minutes to call in with issues, because that's sometimes what happens. We can't get all the calls.
But, I'm available all the time, right? So just give me a call. Yep. Come see me for your issues. I think a lot of people that listen to the show are now realizing that, because I find we're getting a lot of people that are just simply coming in. They're calling saying, yeah, get me that second opinion with Dr. Lou. And that's what they want. And I, again, the whole point of this is to take people, hear them out, see what's going on, and then make the appropriate recommendations. And those recommendations, again, are fluid, right? It's about really, okay, what is the evidence support? What's the clinical experience support? And the really nice thing about me and my team is the clinical experience doesn't just mean me. A lot of times if I see something that maybe I haven't seen a lot of, or I'm not necessarily an expert in, I will go to my team of professionals and really have that dialogue to understand what the clinical experience is there. And it's been an incredible opportunity for me to work with so many different types of healthcare professionals, other chiropractors, physios, massage therapists, naturopaths, athletic therapists, personal trainers, physicians, different types, neurologists, surgeons, orthopedic surgeons, physiatry. Did I just say that? I don't know. Neurologists. So many different people that I have access to that I can speak about with cases, and also make the appropriate referral if required. And it's just taught me so much. Sometimes research is very important, and I keep up to date on the newest, latest research, but there's just something about clinical experience. There's just something about it. And it's a big thing. So, one day what I should do is tally up the total amount of years of clinical experience that we have amongst all the professionals, because it's probably hundreds.
Oh, for sure. That'd be cool.
Yeah, that'd be cool to understand how much, and even the amount of patients, right? Like it's probably in the tens of thousands when you add up everybody in terms of how many different people have been seen. So it's tremendous. And the great thing with this radio show is I always have people reaching out with new things, doing new things to learn myself. I was recently at a conference for concussion. And there's some new things even coming up there that is really, really interesting. And I mean, the stuff that I know from concussion already that I knew prior to this is only about a year old, but it's ever evolving. It's so quickly evolving, and we're starting to understand a lot of things. And one thing that I found really interesting, which is pretty consistent with the rest of the body, like one of the initial recommendations following concussion that a lot of people hear is rest. You got to rest. And it's sort of, there's some new research really supporting, well, you got to sort of be actively resting, right? It's not just like lay in a bed, glasses, dark room.
Heating blanket, lights off, done.
There was some evidence to support that was a good thing in the first 24 to 48 hours. But after that, yes, you have to rest, but you have to actively rest. So it's also, the comparison that the specialist was giving us was, there was a person that he had that had a concussion, and this person was an avid cyclist and was doing about 40 kilometers a day of cycling just for training and things like that. Suffered a concussion, he was recommended, no, you're going on rest for 48 hours, you're not doing anything. But after that, we want you back on a stationary cycle for 10 minutes a day.
Nice.
Just something simple, and then otherwise live the rest of your life, minimize the amount of exposure around TVs, phones, things like that. Not to eliminate it completely, but just, this person was doing that and then went back, and then I guess he was feeling much better. And on his own recommendation, the patient's own recommendation, he went out and cycled 40 kilometers again. And he went and he completely regressed, right back to the beginning. And so the whole thing that we started, and this was just a case example to highlight what we were speaking about based on the research. It's about staying below what your normal threshold is, right? So if you're someone who typically walks 30 minutes a day, like let's just use that, you otherwise sit at a desk most of the day, maybe a little bit of stuff when you get home, yard work, housework, etc. You suffer a concussion. Well, again, you're resting for probably the first 24 to 48 hours. But after that doesn't mean we don't want you to walk half an hour. We want you to walk to the point where you just don't have symptoms. That might be 10 minutes. That might be 12 minutes. It might be 13. It might be 14. It might be 29. We don't know. But that's trial and error. And then the whole goal with the rehabilitation aspect as well, along with other things, is just stay below that threshold until we start to progress you along. So it's pretty interesting stuff. And for a long time, we thought that the rest period for concussion should be much longer. And when we say rest, like absolute rest. And it was funny because especially with injury management, it sounds very, very familiar to what I say all the time. Like someone who's hurt their back, you're not telling them, oh yeah, bed rest for the next, 5 days or 10 days. No, you might, if you absolutely throw out your back horribly and you almost can't move, you probably have to rest for the first day, maybe 2 days.
You won't be doing much else.
You can't move. But after that, once we can get you moving, we're going to get you doing stuff. And moving and doing things is very, very important because again, our body is designed to move. It's not designed to be static. And when you are static, it creates so many other problems. I was saying to you off air, I had another person who had some knee issues, and they're a very active person, and they started slowing down, and now all of a sudden their shoulders are hurting. They're an elderly person too, and they were like, why are all these other things happening? It's like, well, you're not moving as much as you used to, and your joints just can't take that. They're used to that movement. So there's always ways to modify, and I gave exercises that they can do sitting down, things that they can do that limit the amount of pressure on their knees as they go through the therapy and heal. So rest is important, but it's active rest, and it's controlled active rest. That's really the key with a lot of these different things.
And along with that active rest, there's the mental component, because if you're going at 100 and then you're told to rest, you go down to zero.
Yeah.
I did it this week when I put my back out. I took a day and a half off the gym, and I was climbing the freaking wall.
But that's that's a good amount of rest, right? Like you didn't say you took the next month off.
No. I couldn't.
Yeah.
There's
you
no
took
way.
a day and a half.
And
right?
even that was bugging me.
Exactly.
So there's a mental component
100%.
Too, right?
And people, you're eager, you want to go back. So it's nice to, if you're absolutely right, can you find a balance and not have it be, you're not necessarily doing 100 and you're not necessarily doing 0, but can you do 20 or 30 or 40 or 50, maybe even 60 or 70, something that just, within your symptom tolerance. And a lot of that, the answer is yes. The more difficult answer, because, I might get a call that says, well, how much time, if I used to walk 30 minutes and I suffer a concussion, what is the amount of time I should walk now? That's an individual recommendation because it's about staying subclinical symptoms. So it's just before your symptoms start to appear. And that's the same for low back pain, for neck pain, for shoulder injuries. It's about figuring out with the person. This is why working with a healthcare professional is so important. Someone who can figure out all these areas that are individual to you, the person.
You want to reach out, by the way, when the show's not on, 1-855-55 Dr. Lou, DRLOU. Please write that down. Keep it info@paincarecanada.com. But for the short term here, in the next 20 minutes, 416-870-6400 star 640 on cell. Dr. Payne Show, Global News Radio. Dr. Payne Show, 416-870-6400 star 640 on cell. You were talking at the beginning of the show about, different aspects of physio or training. It's like, you don't know everything. You haven't tried everything. It's funny you mention that because one of the trainers from my gym just texted me. and he's near a world class sprinter, and he's from he's via the UK, lives here now, but from Jamaica. And
Right.
they did that. They ran on the beach. They trained in sand. And man, does that increases your explosiveness when you got to trek through sand.
Yeah, and I mean, again, I don't know enough about it, but just based on my understanding of physiology, biomechanics, you're now dealing with something where you have to activate a lot of small intrinsic muscles, right, because of the unevenness of everything. So, of course, there's probably a benefit to it. My issue with a lot of these things is when they're sold as a cure for everything.
Yeah.
Right, that's my biggest pet peeve within healthcare is everything. Like, when one diet is the best for everyone in the world, or one intervention is the best thing for it's like, no, the reason why so many things exist is because there's so many different people.
Sure.
And some things are going to work for certain people. Some combinations of things will work for certain people, and equally so it might not. Does that mean it's the dangerous thing about this type of the rehab world. Like, you meet tons of people like, oh yeah, I went to a chiropractor once. I would never recommend it to anybody. It's like, but maybe it didn't work for you, right? That is a possibility. It's probably a big possibility. Maybe you saw the wrong person. There's a lot of things around that. And so it's really about identifying what the best treatment intervention is for that person and what they're experiencing, which is why the diagnostic component, in my opinion, is so much more important. Because if you get that part right, then the recommendation should be much easier to follow through with.
It's funny when people come up and say, oh, I saw this person, you got to go see them, they'll fix you. Look at you and look at me.
Yeah.
Two completely different dudes.
Yeah, 100%.
I mean, we're both men, but that's where the similarities end, right? You got a ton of hair, I got no hair. I'm 6'5", you're like
5'5".
5 right?
5'7",
right.
5'6.5".
Yeah, so we're totally different people. How is the same intervention going to be good for both of us?
Yeah, or maybe it's the same professional with a different type of intervention. Like, you're absolutely right. That's why healthcare needs to be individual, and especially when you're dealing with the end that we're dealing with, which is the physical medicine. A chemical is a chemical. If we're giving you a pill, then that pill, understanding your body mass, we can tailor the different amounts that you might need. That maybe is a little bit different, but even in that sense, it highlights how different people need different amounts of an intervention. And from a physical perspective, you're absolutely right. Like, someone who's dealing with me, there's so many different variables between you and I, but we may both benefit, for example, from massage therapy. It's just what type of massage therapy so and it also doesn't mean that if massage therapy, like if we both have low back pain and it didn't work for us, that doesn't mean it won't work for everybody else in the world. Right? And that's the important thing. But the diagnosis is very, very important, because when you can identify the cause, you can pinpoint that cause, then you can also pinpoint the treatment intervention, which is the right way to do it. That's the right way to manage health.
And if you've ever, and I know we've had this discussion as well, and I'm sure there's listeners that know this as well. If you've ever not believed any of this, you can leave it all on the gym floor, because there's a guy who's 23 beside me doing the same exercise, me at 48, and it's a completely different thing for him. Yeah. He's got twice the amount of testosterone. He's got better joints. He's still strong. He's still 100%. Young. So it's like, we're not all the same, man.
No, not
God,
at
I think of what I used to do when I was 23 in the gym. I wouldn't even come close. I'm wiser. Yeah. But man, I just can't perform like I used to.
You just can't do the same thing that you used to do.
Not.
Yeah. I mean, a good example, I guess, to highlight how important treatment and intervention is the symptoms around a bacterial infection and a flu are not all that different, right? So, but if you have a virus, if you have the flu virus, and someone gives you an antibiotic, it's not going to do anything, right? You're treating a virus with an antibacterial. It doesn't match up. But if you're able to identify, no, this is, for example, strep throat, there's actually a strep bacteria in there, we're going to give you antibiotics, then the intervention makes sense to the diagnosis.
Right.
And that's the same thing. It's the same thing for the physical body and our physical health is identifying, well, what is the problem, right? There's a lot of people that have, for example, acute low back pain. Right. And the evidence around acute low back pain is very clear. That's when the things like the modalities, manipulation, different machines, massage have a tremendous impact. Mm-hmm. But then as it becomes a chronic issue, that's where it's a lot of self-care and self-management in terms of exercise rehabilitation, nutrition, et cetera, et cetera. So to just, grab everybody that has low back pain. And all I did there was distinguish acute versus chronic. There's so many other variables, but I just want to use those two simple variables to highlight that if we just group in all back pain together and use the same treatment intervention, it won't work.
No.
It will not work. It does not work.
And it's like you said, just getting some basic treatment is a small part of it, like we always discuss. Again, I swear to God, one day we're going to get my mother-in-law on the show and just grill the you-know-what out of her, because she's the one that'll go for physio on a Monday. She's like, oh, it's still killing me. It's not working. I go, what else are you doing beside that one little hour of physio? Are you helping her? No, you're coming home, you're lifting heavy pots, you're doing all the same crap you did before.
Yeah.
There's no follow-up.
No, there's no follow-up. And there's no homework. And yeah, that's an important thing. And this is a big thing that my team and myself do with our patient base, is make sure to make them accountable too. The person has to be accountable. Right. If you're not accountable for what you're doing, there's always something you should be doing when you go home. And if you're not, then, I think most people can understand this. And we meet a lot of people, unfortunately, that sit there. And I had someone that came in this week as well, and it was the classic thing that I often see: low back pain, this guy's not doing anything right. Like, there's nothing right about what he's doing in terms of his health. Just so much wrong. And same thing, he just wanted a quick fix. Oh, so there's nothing that I can just do here today. Yeah. No silver bullet, sorry.
We'll take a short break. Last few minutes of the show. If you want to contribute, 416-870-6400, star 640 on cell. Dr. Payne, Global News Radio. 11:53 Saturday morning, Canada Day weekend, long weekend. Dr. Payne show. Got Michael hanging on the line. Hi, Michael. Good morning.
Yeah, hi. Good morning. I've had this pain in my left knee for about 3 weeks now. I went to the doctor. They did an X-ray. He says there's nothing showing. It's just a sprain. It'll take a while to heal, but it's been ages now, and I just, especially when I get up in the morning, it's fine when I'm relaxed. I don't feel any pain. As soon as I put weight on my leg is when I get the pain.
Yeah. So I just have a quick question, Michael. How long have you been listening to the show? Like this whole hour, or just came across it?
No, I just came in and I remembered that your show was on, so I turned it on.
Yeah, no problem. Okay, because I started the show with a similar. It was a hand issue, but it was the similar type of thing where family doctor took X-rays, said, yeah, there's just a sprain. It'll heal on its own, and then this person went for a year and a half with no treatment, no nothing, and then he finally came to see me, and now he's getting treatment, and he'll likely recover 95%. So these types of things, that's great that you got an X-ray to make sure there was nothing horrible there, but it needs some type of physical intervention. You need to do some type of treatment to that knee in order to get it better. What that treatment is exactly is hard for me to say over the phone. I would need to look at the knee, see the extent of it. Sometimes it's as simple as just exercises that you do at your home and self-care, like icing, elevating, things like that. When I say treatment doesn't necessarily mean 3 times a week for 6 months that you're coming into the clinics. No, it could mean just simple things that you can do at home. It's really whatever is the best option for that type of thing. And actually, with this person that I'm talking about with the hand, what I recommended was actually some self-care initially for the first 2 weeks, certain things that I wanted him to do, and then come in for treatment. So, and it was only 4 treatments that we had recommended. So I don't know the extent of your knee injury, Michael, but you shouldn't just leave it. That is the wrong approach, and that's how we started the show, is saying that approach of just leave it, it'll heal on its own. It doesn't. It doesn't just heal on its own.
Right. Okay.
Yep. Okay. So come see me this week, and we'll get you doing the right stuff.
1-855-55 Dr. Lou, DRLOU is the way to go. info@paincarecanada.com.
Perfect example, right? Like that's how we started the show.
Man.
Yeah, don't and again, a person who's listening to the recommendation of their doctor, and the doctor's like, oh yeah, it'll take some time to heal. I don't know. It's just
use that time and be proactive.
It baffles me. Like, as I was hearing him say that, I started laughing because I was just like, I can't believe that this actually happens. That there's professionals out there that the recommendation is just let it heal on its own. Like somehow this will magically just go away. It might heal in terms of like, some damage or something like that. But an X-ray for a knee, I was telling you that I had a person this week who had just a little bit of knee pain, an elderly woman, just a little bit, and was concerned about it. I took an X-ray of that knee. the amount of arthritis that was on that x-ray in that knee, I don't even know how she was walking.
Wow.
Versus I've had people who have tremendous amounts of pain, almost crippling to the point they can't walk, and you take an x-ray and it looks like their knee's brand new, like they've never even had a little bit of well, because it doesn't really matter. So the point being is with x-rays, you know, really what you're trying to do is rule out any bone pathology, like a tumor in the bone or something like that. And if that's not there, then a lot of it is just functional mechanical problems, and there's something that's happening, and the physical problems need a physical intervention.
It's like a leaky roof, though. You got to get on it. Don't let it go.
No, yeah,
right?
It's a mechanical issue. Like exactly, and that's a perfect example. If you all of a sudden had a leaky roof, you wouldn't just say, "Well, I'll just
put a bucket underneath it."
Yeah,
a bigger bucket and a bigger bucket.
You got to get somebody there to do something about it and fix it. That's the approach.
Quick, before we go, some details on how I get a hold of, how it works with the consultation, everything else.
Yeah, so give me a call, 1-855-55-DR-LOU, DRLOU, or info@paincarecanada.com. You can send me a quick email synopsis, or you can call me, quick synopsis about what's going on. Really, the consultation is designed to determine if this is the best thing that me or my team can assess you for. There's been plenty of people that have reached out for things that we don't manage, that we don't deal with, and we just simply will make a recommendation in terms of what the next point for you should be. But in terms of physical and pain and physical injury problems, we likely deal with them all, but really the answers don't come until the assessment.
Right.
I can't give you something specific to do on a consultation. It's designed to determine if I'm the right person to assess it. If I am, then at that point we can definitely get you the answers you're looking for.
We'll pick it up again next weekend here on the show. Again, you want to reach out, 1-855-55-DR-LOU, DRLOU, info@paincarecanada.com. Till next time, Dr. Payne Show, Global News Radio.